So I was sharing a little bit of my experience. Steve and I were in Chicago last weekend, and we had to get directions or something to a restaurant. So we talked to the front desk, and we needed to speak to this concierge. And the front desk said, "Well, he's over there. It's under the sign that says navigation. We call our concierge the navigator now, or a navigator." So we went. I thought that was interesting. We went over to speak to the navigator, and he gave us directions to where we needed to go. And I kind of smart ass. He said, "So your job is to make sure that we navigate the streets of Chicago safely." And he said yes. So it was fine. We got to our restaurant. Everything was great. So I was thinking about the call tonight, and I sort of said, okay, we need to call this, do we need a navigator doctor? And I was kind of smarting pants. And then I said, wow, maybe we need to say, do we need a navigator doctor? As I look at the changing aspects of medical care now, the influx of patients because of Obamacare, and all of a sudden you're not a patient, you're a number, you're an appointment time. Nobody really knowing where we're starting our journey, where we're ending our journey, and the unique aspects of each of us as we travel through our journey. Do we need a navigator? And I was thinking, yeah, maybe we do. Mm-hmm. And I was thinking maybe Dr. Mankey thought that same thing. Yes, maybe people do need a navigator. So I'm proud to introduce Dr. Selena Mankey to the group. She graduated from Princeton with a degree in biology, and then went on to pursue a degree in medicine from the Georgetown University School of Medicine, where she graduated magna cum laude. After her graduation, she went on to complete an internship and a residency at Massachusetts General Hospital in internal medicine. She served as the Assistant Dean for Student Affairs at Harvard Medical School, and then decided in about 2010 that she really needed to return to her roots in Texas. So she returned to Texas, where she worked with the Seton family of hospitals and the University of Texas Southwestern Medical School in their academic internal medicine residency program as Associate Professor of Medicine. Well, after a while, she decided, after much soul-searching regarding her true passion for caring for patients, that it was time for her to step back. And in November 2014, she started her own concierge medical practice called Westlake Concierge Medicine, where she is delighted to offer world-class medical care to the people of Austin and surrounding communities. So it's my great pleasure to turn this conversation and the group over to Dr. Mankey as she helps us decide, do we need a concierge doctor? Dr. Mankey?
Great. Yes, thank you, Missy. Thank you very much. Well, I'm very happy to be here and be able to spend a little bit of time talking about concierge medicine and what this is. And I think navigation is a great term for a lot of what we do in this model and in this way of practicing. It's a really key aspect, I think, that to medicine and that people need. So I'm going to kind of just go through what this model of medicine is. Please feel free to kind of interrupt at any point and ask me any questions, because I'm sure things will come up as I go through it. And then I'm obviously happy to take questions at the end. This is an outline of what we'll be talking about, probably in the next maybe 30 to 40 minutes at most. I'm going to go through kind of the current state of primary care in brief. Many of the terms that are used to describe concierge medicine and navigation, I should have added that to the list because there are many ways in which it's described. A little bit on the history of how this started, what exactly it is, some of the current models that we see, advantages and disadvantages. I'll talk just a tiny bit on outcomes data. There's not that much out there, but there's more that's coming out. My personal story and how I began this practice, and then obviously some resources that you could use to learn even more about this, and there's quite a bit online as well. So I wanted to start with just talking about kind of the current state of traditional primary care. When we looked at a practice as we know it, when we ask physicians whether they're happy or not, I think it would not be surprising that the burnout rate has increased to an all-time high. And there was a survey that was done in 2014, just last year, that asked internal medicine doctors if they were satisfied with their jobs, and 47% said that they were. And in that same study, only 27% of internal medicine and 32% of family medicine doctors said that they'd choose their specialty again if they could. And that compares to 77% of dermatologists who said that they would do it all over again. Quite a striking difference. And you add to that the average wait times in many of these practices are 30 minutes to an hour, and that's usually with a well-run clinic. And the average time spent with each patient is around 15.7 minutes. This is what you'll see if you go into a regular kind of practice that takes insurance, the kind that we would expect in the current model. Then you look at concierge medicine and all the different types of models that fall into this. And there was a poll same year, last year, from Concierge Medicine Today, which is a news agency that gives quite a bit of information and collects research as it relates to this model of medicine. And it asked concierge physicians, 5 years after opening their practice, were they more or less satisfied than they were in their traditional practice, and 85% said they were more satisfied. And then you add to that the average wait times are 0 to 10 minutes. Usually you do not wait in a concierge practice, and the average time spent with patients is at least 30 to 40 minutes, and that's for just a routine follow-up visit. So quite a difference, I think, in the models that are out there for internal medicine, for family medicine, for kind of what we would call primary care. And I wanted to start with this because one of the things that's moving primary care toward these types of models that are concierge or direct primary care, whatever you want to call them, it's because of this dissatisfaction that many primary care physicians are feeling in the current traditional model. And I think that's fueling this movement, and we're seeing more and more physicians move toward this model because of this. These are some of the terms that are used to describe concierge medicine. You may hear it, and there are many others, but these are just some of the more common ones that you'll see in the literature. You'll see people describe in articles. It could be called direct medicine or direct pay, personalized medicine, private medicine, boutique, VIP, retainer, cash only, membership. It goes on. And they're all kind of describing something very similar. Even though there are some variations in them, it's all a similar concept that I will describe. But just so people know that sometimes these words are used interchangeably, and they shouldn't always be, but many times they are. And they're kind of talking about a very similar concept. Any questions at all so far with any of this? No? Okay. All right. So if we talk a little bit about the history of how this began, many times when I talk with people about concierge medicine, they think it's a new concept, but it actually started almost 20 years ago. It was started in Seattle by a group called MD Squared. And at that time, they were charging an annual retainer fee of $13,200 per patient and $20,000 per family. Granted, I think the level of service was pretty high, but that's kind of how things started. And then a few years later, the Virginia Mason Medical Center in Seattle began operating concierge medical services within its facilities and used some of the profits from the 5-physician practice to subsidize other programs and indigent care services. And there are other kind of major medical centers across the country that do something similar to this. But this was in 2000, years ago when this started. Then in 2001, the American Medical Association wrote the Concierge Physician Guidelines and Principles of Medical Ethics. So the American Medical Association was looking at this, was recognizing this as a new model that was coming out, that more and more physicians were looking at. and wanted to talk about, what physicians should think about in transitioning their practices to make sure, the issues of abandonment would be addressed, and that physicians were careful with reimbursement. What did insurance cover? What did the extra fee cover? And also that the quality of care remained what it should be. So one of the things that this talked about was that it wanted to make sure that because there was a fee that the patient was providing directly to the physician, that didn't in some way influence what the physician decided on for the patient. That the patient wouldn't get everything basically that they wanted when it wasn't maybe in the best interest of the patient because of that fee. So things of that sort. Then in 2002, the Centers for Medicare and Medicaid, CMS, outlined its position on concierge medicine, and they basically stated that physicians could enter into these retainer agreements with their patients as long as that these agreements didn't violate any of the Medicare requirements. And then in 2013, the American Society of Concierge Physicians was founded, and they later changed their name, and now they have a new name. But basically, these concierge physicians who were practicing in this model started to come together and say we needed to have national organizations to support each other, to advocate for this type of practice. And then the AMA issued guidelines for boutique practices the same year. And then finally, that year as well, the Department of Health and Human Services ruled that these types of practices were not illegal and that the federal government basically decided to just take a hands-off approach and allow them to continue and to develop. And so I just wanted to go through some of this history because this was over 10, 15 years ago that all of this began. But I think now more and more people are talking about these kinds of practices as it moves more into the mainstream. And I think, as I mentioned at the beginning, one of the big things driving this is the dissatisfaction that providers and patients, but providers are really feeling in primary care in the current model, in the current state. And then since then, the numbers have grown, and I'll talk a little bit about the average numbers of practices in the country and physicians at this time. But first, I want to go through, what is concierge medicine? And I think if I had to describe it in a nutshell, these would kind of be the three key aspects of any practice that calls itself concierge. And the first is that there's a direct financial relationship between the patient and the provider that has to be there if it's going to be that type of a practice. And that can come in many forms, and I'll talk about that as well. The second is that it's service-oriented. I mean, it is what the word means. That's why that description is there. These practices have been set up to work in the best interest of the patient and to be as convenient as they can for patients, to really work for patients. And the third is it fosters a personal kind of longitudinal relationship between the patient and the physician. And that's one of the key aspects to this model of medicine is that you have a personal physician who knows you, who you can call, who will be the one that will be there for you or your family. But as I talk about this and talk about, these are the most common characteristics, it's important to remember that there are so many variations, and every practice in concierge medicine will be different. And I read somewhere, and I wish I could remember which article it was, but it stated that concierge medicine comes in as many flavors as ice cream. And that is very true. I mean, what is covered in one practice won't be in another. It just really varies, and people can set up their practices in almost any way that they think is fit. So it's always important to kind of look and see what do the fees cover, whether they take insurance or not, all of those different aspects, because they will be different. So these are some of the common characteristics that you're going to find in most of these types of practices. This is what they're going to offer. The first part is that there is going to be a fee. It could also be called a membership or a retainer. It'll be paid either annually, quarterly, or monthly. Again, every practice is different in how that is done. These practices can also take your medical insurance, or they may not, and that will vary. One of the common denominators is that most of these practices have a much smaller number of patients per provider. So it's usually up to 600 patients. That compares to the average primary care provider has around 2,000 to 3,000 patients per physician. So it's a big difference, and it's the reason why these physicians can offer a higher level of service. They're just much more available. They're taking care of less patients. Usually there'll be a smaller number of staff as well. They tend to be very personable, very friendly. And then as well, some of these practices will offer some ancillary services. So they may offer an EKG as well, or certain testing, or some basic x-rays. They're usually basic tests that may be included. Most blood work, x-rays, things of that sort will not be included, and they're usually billed to your insurance separately. And then these practices usually have a very personal, comfortable space environment, whether it's in the exam room or in the waiting room. It's usually set up differently and not like your typical practice. A few other aspects in most of these practices as well. You're going to have longer visits, usually 30 to 45 minutes, as I mentioned before, and that's for just a routine follow-up. You will have access to your physician, usually same day or next day at most. Comprehensive physicals are almost always a part of the package. They can last up to 2 hours. They're pretty detailed. They'll include an EKG, probably some advanced risk assessments, especially cardiac risk assessments. Part of that will also be a discussion on diet, exercise, supplements, screening, much more detailed. Again, it takes more time to go through this. And in these practices, you have access to your physician to be able to have these important discussions. You usually have 24/7 access to your physician by cellular phone, as well as by email. And then coordination of care, which is a key aspect. And I think this is where that navigation piece that Missy was talking about comes in. One of the most important roles that a concierge physician plays is that of coordinating care with other specialists and with hospitalists. It's such a complex medical environment that we're in that I think this is one of the most important things that concierge medicine physicians can do for patients. Is really find certain specialists that they like to work with, coordinate care with them, make sure that results are being given to patients, and that the whole picture is kind of coming together, so that you're being taken care of as a complete person. I think many times people just don't have that in the current system, and that everybody is talking to everyone on the team as well. And then finally, you usually have quick follow-up to whatever questions you have, refills, results. You won't necessarily be waiting for something or not knowing what the results were. You usually have access to that pretty quickly. Any questions so far on any of this?
No.
Nope. Okay.
Selena, I had a comment.
Yes. Yep.
I had a quick comment. I was over at Methodist Hospital a couple of weeks ago in Houston, which was my main hospital, and there were a group of senior physicians that had a meeting, and the main discussion of the meeting was the fact that they've gone hospitalists there, and the major problem that they're having now is the communication to the hospitalist from your physician and from the hospitalist back to the physician, and they're trying to address that, but they're having them. This is one of the largest hospitals in the world, is having a major problem with that. So,
right. It is actually a really big issue in medicine, as most places have converted to hospitalists working in the hospitals and taking care of patients as they come in. That communication many times is lost. You're right. And how do they make sure that they connect to their primary care physician is a challenge, and I've seen that. But many times, in the concierge practice, again, because you're taking care of less patients, it's easier to do that. Usually, like, as an example, if one of my patients goes into the hospital, they will text me, this is what's happening, and I will know, and I will be able to call them, be able to call the hospitalist or the emergency room physician. If I can't see them, I'll make sure I'm talking to them on the phone and that I'm following up. I'm getting the discharge planning. But my office makes sure that happens. And I think that is so important in the continuity of care in that transition. And unfortunately, too much has been written about the errors that happen when that connection is not made between the hospital and the primary care physician or the outpatient practice. So
I'm not sure I know what a hospitalist is.
So a hospitalist is an internal medicine physician who basically just works in the hospital taking care of patients as they come in and need to stay in the hospital. So basically internal medicine, this kind of specialty, has now been divided into kind of outpatient physicians who are the primary care physicians, the ambulatory physicians you see in the clinics, and then inpatient physicians.
Okay.
It used to be that we did both.
Mm-hmm.
And actually in Boston, I did do both for 11 years. I actually would admit my own patients who were in my practice, my outpatient practice, into the hospital when they were sick, and I would see them there and write their orders and then discharge them, and that continuity was there. It has become harder and harder to do that and to kind of be at both places and be available for nurses. And there's just so much now happening in medicine that separation has now happened. So you have physicians who basically do shift work, and they are in the hospitals all the time working with nurses, taking care of the patients as they come into the hospital. And they usually don't have an outpatient practice. Sometimes they might, but usually they don't. Does that help to explain that a little bit?
Yeah, I guess I would have a corollary question. I don't know if this is the time for it, but we do have a concierge doctor. My concern is if I were hospitalized where we live, she doesn't have hospital rights, I don't think, in our local hospital.
Mm-hmm.
So I'm wondering about what rights
what would happen in that
concierge doctor has at various hospitals, and
how
forthcoming the hospital or the hospitalist would be with our concierge doctor.
Yeah, that's a good question. I mean, I think it would probably vary depending on the hospital and where you are. I can tell you just from my personal experience, it has not been an issue. So when I've had a patient, in the hospital, I don't have privileges in the different hospitals, but I am always able to contact the hospitalist that's taking care of my patient. And if I go in, I'm able to see my patient and talk to the nurse. And they might have the patient sign a release is the only thing I've seen happen in some medical centers, but most are pretty open about it. I can't write orders. I can't necessarily tell the nurse what to do, but I can work with the hospitalist and definitely know what's going on. I can give the information I have, make sure they have, the correct medication list. I can make sure that the patient's okay. My patient feels they're being well taken care of. I can advocate for them. So I've been able to do that, and that's already at these 3 different hospitals, and I haven't had a problem.
Okay, thank you.
So, yeah. So I think if they would be willing to go in or at least call and talk and kind of coordinate that care, I can't imagine that would be an issue.
Thank you.
All right. And so then just to go through kind of the number of concierge physicians right now in the United States, when you look at different sources, there are different numbers. But on average, we think there's around 10,000. And around 1,000 physicians a year are converting their practices to concierge practices. And that number is going to keep growing every year is what we predict. The most common specialties are in family medicine and internal medicine, and 66% are in internal medicine. But there are growing specialties. So there are other groups that are thinking about this model of practice, including OBGYN, pediatrics, cardiology, neurology, and endocrinology. Those are the ones that I've seen converting their practices, but I'm sure others will be thinking about it in the future. The fees range from, on average, again, and it varies depending on where you are in the United States and the level of services that you're given, but it's around $1,600 a year to $5,000 a year for most concierge practices. And again, that will vary. And then the practice can be part of a national group, such as MDVIP is one of the more common ones that's known, but there are others, versus local physician-owned practices. You'll see all types as well. These are the three most common models that you will see in a concierge practice. They'll either be fee for care, they'll be fee for extra care, or it'll be a hybrid model. A fee for care practice basically is a practice that does not take any kind of medical insurance, including Medicare. So you'll never be billed. There won't be any co-pays, anything like that. There is basically a retainer or a membership fee, and that's it. And that covers all medical care, all the extra care, everything that you receive from that practice. And then you use your insurance for, labs or x-rays or anything else that's outside of that, usually, and then for specialists and hospitalizations. And so anytime you're part of a concierge practice or a direct primary care practice, we always talk with our patients or make sure that they do have insurance of some type, because this is not insurance. This is just like for primary care. You need it more, obviously, for the hospitalizations and the specialists and things like that. And then there's fee for extra care, and those are practices that actually still take medical insurance. So they will take Medicare or any other plan, but then there's an extra retainer or membership fee. And that is for kind of the extra services. So it's not the medical care that you receive from the practice, but it might be for the increased accessibility that you have, the cellular phone access you have to your physician, and maybe just how nice the waiting room is and the coffee and tea, whatever else. Many times these practices do get legal consultants or a consulting company to come and review that, because it's really important that that's spelled out very well as to what is covered, what's not. And then finally, there's a hybrid model. So there's some practices that have patients that are just basically they use their insurance as any other practice, but then they'll offer a maybe gold or platinum membership. And those are patients that pay an additional retainer or membership fee for the extra care, and they receive those extra services. And so many times physicians will do this who are having a hard time letting go of their patients. They want to keep all of them, but they'd like to somehow convert to a concierge practice, and so they'll do this hybrid model so that they give patients the option of having that additional membership. And you'll see all these variations throughout the country. They really do all vary quite a bit. The advantages to this model are pretty obvious, and a lot of this is going to be repetitive of what I already talked about. But I think one of the greatest advantages is that you are able to have more time and attention with your physician, and your physician can actually really work on getting to know you, and then you're able to develop that personal relationship that is so important, I think, in primary care and in kind of looking at the whole person. And just as an example, I have learned things about some of my patients in the last few months in practicing this model that I didn't know. And I've been taking care of some of my patients for years here in Austin. And I just never had the time to be able to really talk in detail about their history or their family or other things. And so it's been fascinating to me already, just in 6 months, to learn so much more about my patients. And I think that helps me take care of them in an even better way because I know them better. So I think that's one of the key things that happens in this model. But you also have more availability, accessibility, being able to see your doctor pretty much when you'd like to come in. And that same day, I think is wonderful. And that doesn't happen often enough, and we're all busy, so we'd like to have that there for us, I think. And then you have access to comprehensive and proactive care. There's a great focus on wellness and prevention. Even if you're healthy, we usually take the time to talk about diet and supplements and exercise and weight and all of the lifestyle and all of those different things that play such a key role in how well people do, especially in the later years of life. And so we take time to do that, and we hold people, our patients accountable. We're able to keep in touch with them and check in and see what's happening. And then the coordination of care piece, which I think is very, very important, especially if our patients are seeing many specialists, and to make sure that everybody's talking to everyone and that the team is connected is important. These are the words that some of my patients have used to describe me. Basically, an advocate, a champion, a partner. Those are all words that they have used in describing kind of the role that I play in their life and as it relates to their medical care and their health. And I think that happens. And then finally, there's support for you and your family in navigating the system. And so especially in crisis situations, it's wonderful to have a physician come in and really kind of work together with everyone and the entire family to make sure that everybody's connected. And that's another role that they play. The disadvantages, there are critics, obviously, to this type of practice and concerns. And I think it's important, to think about them. The first is obviously that we're creating a two-tiered healthcare system. And I think that is concerning for some people, and for some people, they even would go as far as to say it could be considered unethical to do this in medicine. And so that is something that, we have to think about, as to how we do that. One of the things to know is that concierge medicine has become more affordable. It's obviously not affordable to many Americans, but I was reading a statistic where 60% of concierge practices charge around $136 a month, and that's a big chunk of the practices out there. And so even though that would still probably not be affordable for many patients, it could be for many Americans as well. And if you put that together with maybe a high deductible plan, it actually could make more sense financially. So, and people are thinking about this as they look at the different models. The other thing is that there are other practices out there that are the direct primary care practices that are even cheaper. There's actually a very big practice in Seattle that takes care of around 35,000 patients, and they charge around $30 to $40 a month. And they've removed the insurance company from primary care, and it's working. And so I think you're going to see more and more of these practices. Many of them are actually working with large employers, and that's the latest model that's developing of a primary care practice working to take care of the employees of large employers. So it's basically people are being very innovative in how we can improve primary care and try to include as many Americans as we can, so that we're not just catering to those who can. The second issue is that obviously from a public health perspective, if you do the math, as you have less and less primary care providers, as more of them go into concierge medicine, you're going to have less and less providers available to patients because their panel sizes are going to be reduced. So you're going to have a primary care provider go from 2,000 to 3,000 patients to maybe 400 to 600, and what happens to all those other patients? And so that's a big concern, that we already don't have enough primary care physicians. So what's going to happen if more of them go into concierge medicine? And I just put in here, I basically cut and paste the beginning of an article from Concierge Medicine Today that was just out from around a week ago that talked about this issue. And the writer basically says the doctor won't see you now, how concierge medicine serves the ridiculously rich at the expense of everyone else. And she basically goes through her story of, coming from an international trip, and she had all these symptoms and was worried that she had something contagious, and she was calling all the different kind of internal medicine or primary care practices, and no one could see her because they were all concierge, and they were like, well, yes, if you join our practice, we can see you. And it was very interesting to read it, because that is something that I think also needs to be addressed, and it's an important issue. Hopefully with more of these direct primary care models, again, as it's more affordable, more people will be able to use these models, and we won't leave as many people out. The other thing that I think that could happen is that hopefully as we have happier primary care physicians, they will have more medical students think about primary care again. Right now it's one of the least thought of specialties, and our medical students are not going into primary care, mainly because they see the burnout of the physicians. And so as we have physicians who are happier, and they are in concierge medicine, hopefully that will change. And it seems like the number of medical students is going to increase in the next few years, and so I'm hopeful for that. But these are important issues, obviously, to think about. And then, the other question is, we know patients are happier in these models in concierge medicine, and physicians are happier, but do they actually do better, in the long run? And there's more data coming out looking at outcomes, at health outcomes, that is showing that this is the case. And this is just two examples, and there's more out there that's coming out, but a lot of it is preliminary. But there was a study in the American Journal of Managed Care that found that MDVIP Medicare patients, and that's one of the largest kind of concierge practices in the country, that they had a 79% reduction in hospital admissions compared with the general population of Medicare patients. And then there was another study, and this is from just a few years ago, another study in the British Medical Journal of a direct primary care group called Clients. They're in Seattle. This is the one I talked about before that has 35,000 members, and half of them are on Medicaid, and they charge around $30 to $40 a month. And they also showed positive results where the study found that their patients experienced a 35% fewer hospitalizations, 65% fewer emergency room visits, and 66% fewer specialist visits, as well as an 82% less surgeries than similar populations. And so this research is being done, and you're going to hear more and more about how patients do in this model compared to others. And I think we're going to see, as we would expect, obviously if you have more time and attention with your physician, that you would do better. That's what we would think would happen, but I think we need to keep proving that. Any questions so far on any of this?
Really? Yes. Actually,
Yes.
I do have a question.
Mm-hmm.
With this model, if you look at it from an economic standpoint, isn't there an incentive for the concierge doctor to only take on healthy patients, given the model that if they're providing all these services, does it start to become more like the insurance companies where all they're doing is cherry picking the healthiest people so that they have the fewest number of calls and services?
Yes, I think that is definitely a potential danger in these types of practices. There's no question. And so that's one of the things that critics talk about is that concern, that you're going to have the healthiest patients in these practices, obviously, because it would make more sense. We would hope that that's not the case. I think I cannot say what different practices do and how they choose which patients they allow in the practice. But, I have all types of patients in my practice, and I have some, one of the interesting things that I have found in doing this is that some of my sicker patients are not necessarily my highest utilizers. And so I have, my youngest patient is 21, my oldest is 86, and it's my younger patients who call me the most and who come in and see me more regularly. And so it's interesting how, sometimes you think you could predict, if they're sicker, you're going to need to see them more often, but it's not always the case. You can't always predict who's going to utilize you the most, which I have found very interesting. But it is an important concern, and it's something that critics bring up. Any other questions? Hello?
Yes.
No? Okay. All right. And so then just to talk a little bit about my personal story. So I've been practicing for 15 years, both in inpatient and outpatient internal medicine in Boston and then in Austin. And I opened up my practice just a few months ago. I've been amazed at how many patients are interested in this model. And I tend to hear some of the same stories when patients call me about, the issues they were having and maybe not always been able to see their doctor and wanting more attention and wanting to have someone who knew them and could coordinate their care. And I was actually, the reason why I opened up my practice and decided to use this model is that I was looking for this for my parents, and working with them and coordinating their care. That's one of the things I thought of was how wonderful it would be for them to have a concierge physician who could do this for them. And then I basically do not work with insurance. There's just an annual fee that's based on age. I'm going to have a very small practice, but I can offer more service to my patients and do practice evidence-based medicine and holistic care, which I think is important to look at. I do try to use as much as I can the scientific literature that is available and share that with my patients as to what the best next steps might be for whatever issue. And then if I could describe my practice in any way, it's that this is what I'm trying to achieve, and that's to combine the technology and knowledge of today with the medicine of yesteryear. And many times my patients will say that they feel like they're going back to how, things were when they were younger, before managed care, and that's a lot of what I'm trying to achieve. Just to talk a little bit, if you want to read more, there's obviously so much in the news, and you're going to keep hearing about this model of practice throughout the country, and practices are opening up in every city pretty much. But these are 3 articles that I thought were really interesting, one from Forbes, another one from the Heritage Foundation. That was a really good review of what direct primary care is, and thinking about it as an innovative alternative to conventional health insurance. And that's what's really being talked about right now, is looking at other models and not necessarily using our traditional health insurance for primary care. And then finally, medicine's about to get personal. I saw another story from Time magazine just from a few months ago. So these are all things you could read that summarize kind of what concierge medicine is and why or why not you might want to think about it. And then finally, just some more resources. A lot of these are online, but concierge medicine today gives an incredible amount of information about what's happening in this type of practice, all the different associations that are available, what it means, and you can kind of look at that. That's online. There are 2 national organizations right now that help to advocate and support concierge or private physicians. There's the American Academy and the American College, which was just developed last year. There's also a direct primary care journal. And finally, there are even some books and guides for patients that you can look at if you're thinking about, joining this type of practice. And the first is a direct primary care consumer patient guide, and then there's also a patient guide to concierge medicine. And that's produced by the people from concierge medicine today. And so that's basically it. I don't know if anyone has any questions, please feel free to ask, but you can also contact me. My email address is here and my phone number, and you can also contact me through my website. But if there's anything else you'd want to ask me separately, please don't hesitate to do so.
I've got a question. If you could give an example, you mentioned that a lot of your patients have insurance and use insurance. Can you give an example of, during a physical exam, what tests might be billed to insurance and what might not be billed to insurance, how you would incorporate your traditional medical insurance, whether it's private or Medicare, with the concierge doctor?
Right. So, again, that will vary depending on the practice. For my practice, because I don't work with insurance for my services, but basically any blood tests that are done are still billed to Medicare or to your insurance. There are some practices that will include some basic lab work, very basic, in the membership fee. But then anything beyond that, your insurance would be billed for that, or you would be expected to pay for it. So in other words, some practices might include, a blood cell count and some basic chemistries and maybe a thyroid test. And it'll be a little bundle, and that'll be it. And then anything beyond that would be billed to your insurance. Other practices do not include any of the blood work necessarily. and all of that gets billed directly to your insurance. So that's usually how it works. The difference, the fee is really going to more of the comprehensive kind of physical, the longer discussion, the review of, supplements and diet, just the longer time that is spent. Many times an EKG will be included in the fee and things of that sort. But again, it will vary based on the practice.
Dr. Mankey, is there a good way to go about finding a concierge doctor? I have one, but I would like to find one closer to me.
Yes, that's a good question. I'm trying to think. Many times, I'm trying to think of what my patients will tell me. If you just Google search, concierge physicians, if that name is in their practice, it will come up. And that's one of the easiest ways. Now, not all practices use that word, and that's where sometimes you can't find physicians as easy. Sometimes they'll use private medicine or holistic or just any other word, all health. I mean, I've seen all kinds of names used for concierge practices. Concierge medicine today does have a list, a directory, and so many physicians, if you go to that website, and I'll go back to that, many physicians do list themselves on there, and it's by state, I believe. So that might be a way to do it. The other way is if you go to the American Academy of Private Physicians, to that website, it's AAPP.org. Many concierge physicians are listed there as well by state. So those might be other opportunities to find someone kind of in your area that might be closer to where you are. And then I'm trying to think of other ways, but those are usually the more common ways to find people. I have a comment on that.
There seems to be a lot of retired doctors that are becoming concierge doctors as they're winding down their practices, and I'm wondering about, are there requirements for keeping yourself current medically?
There are many of our older physicians, though, have been what we call, quote unquote, grandfathered into where they don't necessarily need to maintain their certification. But for most physicians, there are certification requirements to be able to be board certified. That is one thing you can ask. When you're going to be part of a practice, you could ask if that physician has maintained their certification or not. There's controversy around that, a lot of controversy actually around what that means. But that's one way of trying to see if physicians are staying current. It's really difficult to you can't really say that just because someone's board certified that they're definitely current. You'd hope, but that's not necessarily the case. Other than that, it's a lot of times it's word of mouth. It's what other patients' experience has been with that physician, and whether they share their knowledge of the literature, of the latest studies on different topics and things of that sort. There are many ways for physicians nowadays to stay current through websites and things like that offer kind of the latest studies that are coming out in, let's say, for internal medicine. I receive emails every day on what are the latest journals saying as it relates to my specialty. And then obviously there are continuing medical education requirements. Every year physicians are supposed to do a certain number of hours on continuing medical education. But other than that, I can't think of any other ways.
In Texas, you're required to have 25 CME hours a year to maintain your license, totally separate from your board certification. And
right.
There have been some very good studies that have been done recently that show that recertification every 10 years that has occurred recently is a waste of time, because most recertification tests your entire specialty rather than the subspecialty that you're in. But the 25 hours is focused on the 25 hours that you're in your specialty. So, as in Texas, you have to have 25 hours, or you don't get your license. So
right,
it's,
right, and that's usually specialty specific, right? And right, the recertification is really controversial, and there are many groups that are actually fighting it to trying to do away with it, actually. So
the ophthalmology is thinking about doing away with it because
yeah.
it's been shown in every study that they've done that it is not effective
at
all.
Not, right.
But CME is very effective. So
yeah.
As far as finding a concierge doctor where you are, one other option could be to use an insurance broker, which many of us being in business use an insurance broker for finding medical insurance for employees, or we have in the past. If you have one that you trust, they can give you the names of who they think. It's a different perspective from a different angle that I think could be very helpful.
Thank you.
Can you describe? Can you give us a couple of things that would be the most important things for us to consider, or questions to be asking a potential concierge doctor in our review and selection of them?
Yes. I mean, I can give you my opinion on what I would think is important. Definitely just meeting them is one of the key first steps, I think, because you're trying to develop a pretty intimate personal relationship with this physician. So you want to make sure it's going to be a good fit, and that they will be able to communicate with you well, that you'll get along, those types of things. That's usually the first step. You can ask kind of how big the practice is going to be. I think that can sometimes help determine the level of service and how available the physician will be as well. Go through what is kind of included kind of in the practice and in the fee, those types of things. I think those are good to kind of go through, so you know what to expect and what's kind of part of the practice. Those are kind of the first kind of good questions, I think, to ask. It's always helpful to know, their experience and kind of where they trained, those types of things. But also kind of maybe I've had patients, ask me, how do I stay current? What do I use to kind of be following the evidence on what's happening and what's changing and where the guidelines are and those types of things. So you can ask all of those types of questions, which I think are important to kind of go through. Is that helpful?
Yes, thank you.
Yeah.
Is there an advantage to joining a national or regional concierge doctor practice? I was thinking, so let's say you've got a couple or 2 or 3 homes, and so you're in different parts of the country throughout the year. I'm thinking there's an advantage to joining something like MDVIP. So if you so do you see the growth in regional concierge practices growing?
Yes, I think those practices are definitely growing. There are some advantages in that they, from my understanding, they do have connections from one practice to another and can connect you based on the city that you're in, and that can be advantageous. I do think it really does depend, because many of those practices, those physicians see up to 600 patients, per provider, which is typical for concierge practices, but you'll find some of the more local practices in concierge medicine might be smaller than that. And if that's the case, they might be able to offer a different level of service. It's something to look at. And the other piece is that, even though you may be connected to other physicians, in that group, you're still unfortunately not seeing somebody that knows you. And so, that's another thing, that you might get the same level of service, which is nice, and be able to go to a practice that's similar that you expect. But again, you won't be seeing your own personal physician. So I think there are definitely some advantages, but and I see it growing, but I also see kind of local physician-owned practices growing. where they really don't want to work for anyone else. They only want to work for their patients. And they're able to stay smaller as well, and kind of offer more service and be available to their patients. So it just varies.
Are there very many solo practitioners? I mean, ours is a solo practitioner, and I've had the thought, and it's probably in our contract, what happens if something happens to her?
Right. And so I think, what's interesting is that even the more kind of regional or national practices, many of those are one physician practices. So a lot of concierge medicine is really one physician with a nurse and an assistant, sometimes 2 or 3 physicians at most. They're smaller practices. And yes, that is a challenge if something happens. Many times there is a backup, there is a coverage person that you could call if they're not available in case of an emergency, something happens. But for an example, in my practice, I always have my cell phone on, and whether I am out of town or not, because that's a key component for me, is to make sure that my patients are able to connect with someone who knows them. And so I do leave that on. But if I am, let's say out of the country or there's a real family emergency, I'll have another physician that I'll ask to just cover for me. And then I will usually have certain urgent care centers that I like that I'll recommend if one of my patients really needs to be seen to go in there. But most concierge practices are small. There are some that are larger, but many of them are 1, 2, maybe 3 physicians. That's basically how they're run.
And are you seeing many of them run by some of them run by physician's assistants or nurse practitioners? I guess I should say.
Right. I'm not. I know those exist, but I don't see as many of those yet. That might be something that grows. That type of model might start to grow, but right now it's really mainly physicians who are developing these types of practices.
Okay.
Yeah.
Okay, we're almost done with our hour. Is there any more questions or? Well, Dr. Mankey, thank you so much for taking the time to explain this to us. I think you answered a lot of questions we've had, probably caused more questions, but
yes.
I appreciate your time and opening up this new but old way of practicing medicine. It's been really enlightening, and I appreciate your time.
Yes, thank you. Thank you for having me.
Any more questions before we all hang up?
Missy, it's Jenny.
Hey, Jenny.
Just want to say that in the last 3 or 4 months that we've been with Dr. Mankey, it has been an amazing experience. And I'm so glad that we did the switch to concierge. Very healthy and, don't have a lot of issues, but she is so attentive, and it's absolutely amazing the care that we get. So I can highly recommend this type of service to anyone. But do your research and pick out the right concierge practice. So
perfect. Thanks, Jenny.
Thanks, Jenny.